All right, so there's a bunch of you guys asking about medical marijuana. A couple of caveats. Obviously, we don't prescribe it, can't say for sure, but I can tell you about things that we notice. So number one, if it's legal in the place they live in, we notice a couple of pros and cons about using medical marijuana as a palliative, as a way to subdue their symptoms. And there are two main places that we've seen it in other people anecdotally be useful, is in helping them to be able to fall asleep. It doesn't necessarily help with sleep structure, but it can help with falling asleep portion of insomnia from what we've seen. There's not a lot of literature that supports this. This is just anecdotal. And then the second place is in pain. And in chronic pain, there is some literature that supports that. We do see sometimes that it is palliative for people in that sense. Now, the downside, the con to this is that we do see in the literature and even in Dr. Raymond's SPECT scan studies that we do see deleterious effects on chronic users of marijuana and brain functionality. So there's this balance and utility that I think is worth weighing out as you seek this out. Obviously, for a lot of people, there's a desperation to just feel better. So that's going to shade the way a lot of people will approach it as well. But just doing that with the understanding that chronic use over time can be problematic when we look at brain structure and function. So use at your own risk.